recent article in the Australian newspaper highlighted a number of DIYs regarding people's health, from ice baths to red light therapy. Do they really work is the big question. Well, joining us live is Professor Jason Kovacic, Executive Director of the Victor Chang Cardiac Research Institute and Cardiologist at St Vincent's Hospital in Sydney. Professor, thank you very much for joining us on this Easter Sunday, especially.
Janie, it's a pleasure. Thanks for having me.
So you are part of this article in the Australian. Very interesting indeed. There's a lot there to look at. But first of all, I wanted to ask you about ice baths, because it does seem like it's a big rage for many people, hopping into the ice bath and then hopping out. Is it good for us?
Right. I mean, there's so much interest in all of these things. People spending so much money in these biohacks. So, trying to short circuit aging and things. And you're right, cryotherapy, ice baths is one of them. And there's companies out there selling special ice baths that you can pay thousands of dollars for. Look, it's like a lot of these biohacks, there's no really hard evidence to support that they actually work. And in some cardiac patients, ice baths, for example, may be a bad thing because they cause vasospasm. They cause sudden shifting of body distribution of fluids. And for people with heart failure or other cardiac conditions, that may be a real problem.
What about things like red light therapy? How good are they?
Right. Red light therapy, also known as low-level laser therapy. Again, there are claims that this can cure all sorts of things, from side effects from chemotherapy to muscle aches and pains to wound healing to hair loss. The data is just unproven. There's no solid randomised control data to show that red light therapy actually works for all these claims. It's certainly promising, but there's a lot of work needs to be done to show that this therapy actually works.
There's a lot of good advertising out there, isn't there? It's certainly, people come up with these different photos and so forth, whether it's the ice baths or the light therapy, they feel better, they perhaps look better. But again, there's no scientific evidence, as you mentioned. What about, juicing and diets and supplements? Right,
extreme diets, juicing, expensive supplements, all of these things. It was the Kardashians actually took NAD therapies intravenously one time on their show, and that caused a lot of interest in these things. But again, there's no hard evidence for these sort of extreme diets. We do know that the Mediterranean diet is a fantastic diet that's proven to save lives, reduce the risk of heart attack and stroke. So the fundamentals are important to get right.
All right, and so what does work? You mentioned the Mediterranean diet. Do we need to test, blood tests, and how often?
Right, there is so much data to support getting the fundamentals right. So that's a healthy diet, it's a Mediterranean diet, exercise, weight control, blood pressure management, cholesterol, avoiding diabetes or glucose control if you've got diabetes, not smoking, and getting the right amount of sleep. There is an overwhelming amount of evidence to support these things. Now, I get it, not everyone wants to go exercising for half an hour, 40 minutes most days of the week. We all want the easy option. We all want that magic pill to live forever. But the reality is the data supports doing those fundamental things really well.
So it's basically, going back to basics.
Right.
Back to the supplements as well, because people might see advertised, have vitamin D, vitamin B, whatever it is, and they go, oh, I could just have this. How important is it to really go and check with your doctor? Because you might be, high in those vitamins yourself naturally.
The evidence is very clear that eating a healthy, balanced diet is pretty much all we need to do. There are the occasional patients that have specific nutrient deficiencies for gastrointestinal reasons or other things, and certainly they need supplementation. What do I tell my patients? Look, if they want to take a multivitamin supplement that makes them feel better, I'm fine with that. And most things that can be bought over the counter in pharmacies are generally fine. I'm not generally in favour of unknown therapies that can be bought on the internet or the black market or imported, that we don't really know what they even contain. These can contain sometimes derivatives of cocaine, derivatives of opiates, powerful vascular effects that really aren't going to be good for health. And
with our heart, we know that it's the number one killer, isn't it, for Australians? Is that right?
Cardiovascular disease is the number one killer in Australia and worldwide.
And that has been the case for many, many years, prior to COVID.
Absolutely.
Yeah.
It has been the case, and it's the ongoing case. And the number two killer, which is dementia, interestingly. Dementia has a large cardiovascular component. So stroke, which can be of heart origin, low blood pressure, cardiac failure, they all conspire to add to dementia. So cardiovascular disease, dementia, the number one killer overwhelmingly in the country.
All right, and I mean, personally, I know a couple of people that have had, one was a triple bypass and they were in their early 50s and they had mild symptoms. They did have a history of heart problems, and literally their life was saved because they felt those small symptoms.
Right.
So it's clearly important, isn't it, if you do have those symptoms?
So
we hear so many stories.
If people are getting chest pain, it's so important to get checked out. And if it's severe chest pain, you should call 000, get an ambulance and go to the emergency room. You know, if it's something that's stable, see the GP, see a cardiologist, but get these things checked out. We often go back to this, but the tragic passing of Shane Warne really served to highlight to us how this can happen to anyone. It can strike people down in the prime of their lives, and nobody's immune.
That's right. Yeah, really good points. Thank you so much. Really interesting read in The Australian if people want to check it out. Well done. Thanks so much.
Thanks so much, Janie.